Hey guys, this is Dr. Hub. Today we'll look at the syphilis and also their diagnostic serology. So to begin with, first we look at the non-treponemal test. The non-treponemal test. So under this there is the VDRL as well as the presence of the RPR. So to begin with the VDRL, the full form is, it is the venereal disease research laboratory test. Then comes the RPR. The RPR stands for the rapid plasma reagent test. So what are the components here? So it includes the quantitative test, that is the titers. Then comes the reagent antibody test, and they are based on the cardiolipin antigen. So it is based on the cardiolipin antigen. Next is there is a VDRL. There is presence of VDRL, so they can be used to test the CSF, whereas RPR cannot be used. So RPR, if you see, it is not used, it cannot be used. So in terms of the RPR, they does not require preheating of serum unlike the VDRL. So it does not require preheating of serum. So this was the case in case of the VDRL, but here it is not required. In terms of VDRL, it requires the light microscope. It requires a light microscope, and this is for the interpretation. Whereas the RPR can be read macroscopically. So the RPR, they are read macroscopically. So the decrease in the titer confirms the treatment. The decrease in titer, they confirm the treatment. And the sensitivity of the RPR. So the sensitivity of the RPR is 86%, and this is greater than the VDRL, that is 76% in the primary syphilis. Now let's look at the treponemal test. So looking at the treponemal test, this includes the FTA-ABS. So there is FTA-ABS. So FTA-ABS is nothing but the fluorescent treponemal antibody absorption test. Then comes, there is a TPI. TPI stands for the treponemal pallidum immobilization test. Next, the TPPA. This is the treponemal pallidum particle agglutination test. Next, there is a TPHA. So TPHA is for the treponemal pallidum heme agglutination test. Next is the EIA. EIA stands for the enzyme linked immunoassay. Now let's look at some characteristics. So they detect the antibody to the treponemal antigens. They detect the antibody to the treponemal antigens, and there is also presence of the qualitative test. There is presence of the qualitative test. This is greater sensitivity in early infection. It is a greater sensitivity, and this is to the early infection. Next is there is a positive it is positive even after the treatment. So it is positive even after the treatment. Hence it cannot be used for the detect reinfection. So it is not used in terms of detecting the reinfection. Next is, it is a first test to be positive. It is a first test to be positive, that is the FTA ABS, and it is most specific. It is most specific. This is to the TPHA, to the TPPA as well as the EIA.